My name is Dr. Matthew McDonnell. This is my colleague, Dr. Gino Chiappetta. We're spine surgeons here at University Orthopaedic Associates. One of the really neat things about being a spine surgeon is the variety of patients we treat and a variety of different spinal surgeries that we do. Some of our patients have significant problems, deformity, traumatic injuries that require bigger surgeries through bigger incisions, surgeries that can take many hours sometimes. But then we also get to see and treat a lot of patients with conditions that we could treat through more minimally invasive techniques, and in doing so, maybe make the recovery from surgery a little bit easier for the patients and get them back to their life a little quicker. So I thought we could touch on some of the conditions we treat with minimally invasive surgery and what those options are.
Sure, I would agree. I think with minimally invasive surgery, it definitely has changed the landscape of type of surgical procedures we can offer patients. Typically, things that we can perform minimally invasive surgery on to improve are herniated discs in the neck or lower back, spinal stenosis or nerve compression, degenerated discs, slip discs of the spine. The technology we have available today has been significantly better than it was even 10, 15 years ago.
So we just, like 10 years ago, we were treating disc herniations minimally invasively through tiny incisions. But I think one of the more recent things that's been sort of become more common in our practice over the last 5 years is we can even offer patients now that need spinal fusions, minimally invasive options for spinal fusions. So
correct.
You want to share with the viewers what that involves?
Sure. So procedures that had been done in the past with larger incisions, hospital stays, more blood loss, more trauma to the body with longer recovery can now be done with smaller incisions and accomplishing the same exact goals with better outcomes. Same-day surgery means they're home the same day as a surgical procedure, less infection risk, quicker return to work, quicker return back to the gym. I think technology these days is much better for spinal fusions. Dr. McDonnell and I actually were the first team to implant an all-titanium 3D printed spacer cage into the spine, which can really help speed up recovery, reduce the cost of surgery, reduce the complications of surgery. So it's very gratifying to be involved in that technology.
Yeah, and I would encourage any patient who thinks that they're a candidate for surgery to come in, visit our website, schedule an appointment, and we could kind of talk about what all the surgical options are for you, and if you have a condition that is amenable to treatment with one of these more minimally invasive techniques.